It's about 5 years ago, almost exactly 5 years. I remember being in my hotel room in Berlin, and I didn't feel nauseous. I didn't feel anything wrong, but I just sort of spit up like a baby would, you know, and I was really surprised, and it just out of nowhere, and I thought something's wrong. I think women are so used to feeling bloating that it's a hard thing to recognize as a symptom that's out of the ordinary. I didn't experience any abdominal pain per se. I did spit up a few times, and I thought that was odd, that my food didn't seem to go down right. But that's at the other end of the body, so I don't know what that may have to do with it. I noticed that when I was bleeding and I tried to use a Tampax, it was very difficult for me to get it into my body, and I think that's because the tumor was there. And I thought, you know, this just doesn't, it's just not right. And so I just turned on a dime and got on a plane, came home, called my gynecologist. I went through all kinds of tests. I heard her say, "Oh," she said, "I can't find your ovary. She said, I can't find your right ovary. I don't know, I can't see it." And then she said, "Oh, you've got a mass. I see a mass here." I think I started to shake from that moment on, my body was just totally shaking. And she said, "Now don't worry, we're gonna get this taken care of." I kept thinking how lucky I was that I was able to get there so fast and do all of these, have the answers so fast. I kept thinking how frustrating it is when you can't have the answers so quickly and you have to wait and wait. I was in the hospital within like 2 days, and they had the operation over with. And I remember waking up at the hospital and seeing this kind of distinguished looking man next to my bed, and I thought, oh gee, I wonder if he's married. And he was my oncologist. I thought, oh, thank God, this is going to be so easy. And so he was suggesting 6 rounds of chemotherapy, and that he wanted to get started right away. And the other thing that I was very lucky about was that I was able to take a lot of the chemo, and that he ended up giving me, I think, 9 treatments instead of 6, and my body really held up well under that. I was supposed to do a movie. I wore a wig in the movie. That was the easy part. The hard part was when I didn't go to work and I had to deal with putting my own makeup on and wearing a wig or tying a scarf on my head or something like that. And somebody sent me a video of all these different ways that you could tie a scarf on your head and make things look better. And now, looking back on it, I wish I had just gone bald. I remember going to a disco one night, bald. I was with my friend who had been sick with cancer and who beat it, and he said, "Just take your turban off and come dance." And I think somehow the whole experience was the best thing that ever happened to me, because it focused me on what was important to me. And I wanted to live, and I wanted to enjoy what life was left to me. I remember even a couple of years before being diagnosed with cancer, being very curious about the CA-125 test, and I didn't really understand until recently that if you've had cancer, it's a really good test to have, but it's not a useful screening test for the mass population. I'm still having a hard time wrapping my non-medical brain around that one. So I'm so lucky to be sitting here talking to you about this. I can't overemphasize that enough, and to just urge women to pay attention to what's going on in their body, and they know themselves better than anybody. We all know ourselves better than anybody else. If something is off, and if you don't look right, or your color's not right, or you're having trouble eating, or if you're feeling unusually bloated and your pants don't fit right, or whatever it is, there's something that's bothering you. So what if they think you're crazy for going to the doctor? Go to the doctor and find out what you need to find out. And because everybody makes mistakes, even doctors make mistakes. So it's better to be erring on the side of caution than to be too late to do anything about it. And that's why I wanted to come and finally share my story, because I didn't have the courage when I was going through it, and I was just focused on my own survival and kind of hiding out instead of coming out with it.